better.
Okay. Hello, everybody. Everybody's starting to get on there. Hey, Holly.
Hello. Hi, Kimmy.
All right. How are we doing? Looking good?
Oh, there's one camera. We can't see anybody. That's okay. I understand the camera's off. Oh, there we
I
go.
can see your faces, though, if we can. But
Hi. Yeah, it's nice. Well, I think we can just start, and as people get on,
yeah.
they can join in. Okay. Well, welcome everybody. I think this is our third Q&A session, right? And we just did Colorado Springs last week, so we're hoping that some of our Colorado Springs people will be on there. But if not, we're happy to see whoever can make it. And of course, they're recorded. So if you have to get off or you can't ever make one of them, if you're on our newsletter, which you obviously are because you're on here, the recording can be it'll be emailed out, I think maybe tomorrow or something. So okay, well, does anybody have any questions starting out? That's what we've been kind of doing, is just a free form Q&A. You can ask anything, CFT, any questions about clients that you have, about about business questions, about explaining brain cycle, about explaining CFT, just anything at all that comes to mind. Let me open up the chat box so I can see them too. Okay, here we go. Okay. Yes, you can raise your hand and we can see that, or you can type in the chat box, whatever, either one.
I have a question.
Sure.
Okay.
Can you hear me okay?
Yes.
Okay, great. I know in the infant training, you guys had mentioned something about anesthesia. And I had like a conflict in my notes, and I'm treating an infant who's going to have a procedure soon, and the parents are concerned about having to stop because I see him weekly. He is 11 months old, was born almost 4 months prematurely, spent 4 months in the NICU. So he's been getting CFT almost every week from me for the past 3 months, and it's going really, really well. But due to a couple different conflicts with the family, they weren't able to get his circumcision scheduled, and they would like to do this. I have no judgment. I told them I would double check on the anesthesia piece with you guys. So if you can answer it about this specific case, great, but also in general, for any type of surgery or big or small procedure, I just wasn't sure about that component, because I also had the note that CFT could help clear the anesthesia from the body. So I just want to make sure I understand when is a good portion to hold off on the CFT, when to reintroduce it for him, so I could give these parents, some peace of mind. And then how soon after his procedure can I resume, whether it's weekly or further out. So if you could speak to that, I'd appreciate it.
Pam, you want to answer that? Because I feel like I missed part of the question.
So I think that every case is different. So what I'm getting is this infant is going to have a circumcision. He's going to have to go under anesthesia. And so what I most likely mentioned in the class is that when you think about it, anesthesia is, thank God we have it, but it is a trauma for the brain. So if any of you have ever had to go under general anesthesia, and I have, you come out of it and it takes a good while for you to kind of get feeling back to normal. And I know that after I have been worked on with CFT, I had Barry come and help me out after surgery. I felt like myself again, like almost immediately, to open up that brain cycle again and to start moving and clearing things. And so I think that it's important after any kind of surgery, in relationship to the anesthesia, number one, to get the brain cycle moving again for clearing and for healing. So as far as how far after a surgery do you work on someone, I think it always depends on what that surgery is. And we may not go to that local area for quite some time. But I would, on a circumcision, I'd be letting that baby heal, at least for a few weeks before I would go in and start, really, especially because the infants are going to unwind in a way much more globally than, a lot of adults would. So. Yeah. And I am astounded, and I'm just feeling so much more of this. I just keep coming into my awareness with the circumcisions. And a lot of times the parents aren't telling you about them, but when you can feel the strain and you may ask the question, there's a circumcision. And not only that, sometimes it didn't go well. And it does really cause a lot of strain on these babies. So it's CFT is
Okay.
a good
And
piece.
just as a brief follow-up, when he was in the NICU, he did have to have abdominal surgery on the bowel. So I'm already aware of that component, and that this may or may not influence that. It's on my radar. So
Yeah.
okay.
I'm
Thank
glad
you.
Lucky to have you working on them weekly.
It's been an adventure, and he's been a great case to learn with, since I was able to start so soon after the training. So thank you guys.
Yeah,
Awesome.
good. Fantastic.
I think we have some questions in the chat.
Go ahead, Holly.
Ruchi, yeah, I just got asked by my patient if wearing a necklace would affect their brain cycle. No, your necklace is not going to affect your brain cycle. No problem.
Brittany has her hand up.
Okay, okay, Brittany. Let me just answer Carly since it's right here, and I'm gonna read it too. I've had multiple clients who have had 4 to 5 sessions and immediate relief of symptoms right after the session, but then continue to tighten back up a few days later. I know it'll be different with everyone, but generally speaking, when should they anticipate complete relief? Well, that also is so individual and so depends on what they have going on. What other factors are contributing to their health conditions. So some of those things could be tightening the fascia back up. So if we're unwinding and addressing the fascial strain, I don't know if you can write, Carly, what else they have going on health-wise. But it could be an ongoing long-term process. I don't know what else they have going on, what kind of conditions you're dealing with.
Yeah,
But that's great.
People go back to whatever it is that they do, whether it's maybe they're clenching their jaw, maybe they're wearing the wrong kind of glasses. Are they wearing some kind of an appliance at night? Maybe they're going back to crappy eating or stressful lives, or some kind of a postural, mechanical issue that they're doing. So it does really depend. And so you can start to ask questions and dig a little bit deeper to see when you say they're tightening up, again, do you mean their brain cycle's going back to 0?
Migraines.
Okay,
Migraines.
very common. Yeah. So migraines are very common. I work on a lot of migraines. So migraines can take some time. What we're looking for with migraines is some kind of progress. So they're getting them less, they're not as intense, they're getting out of them easier, they don't need to have to take as much medicine, they're not as triggered as easily. So they're the kinds of things that you're looking for the progress, and then they look back over time and there's been quite an improvement. So take really good notes, because people forget and they just focus on what's the negative thing going on at the moment. But migraines, I'd be looking at things like, are they clenching? What are they wearing? Are they wearing appliances at night? What do their glasses look like? Are they under fluorescent lighting a lot? What's their diet like? I mean, there's a lot of other components to the migraines, but if you open up the brain cycle and it continues to open and continues to hold, the migraines will improve.
Jagruti, you have your hand up. I don't know if that's part of the other if you have another question, go ahead.
So I have a 13-month-old coming in for an eval tomorrow with the primary concern that she uses involuntary movements to kind of get out of her fight or flight mode, kind of like stimming movements. And she has had a tongue tie release surgery when she was 2 months old. So mom's like, super anxious about her being extremely tight, and there is a history of rough birth as well. I don't know what the exact history is until I evaluate tomorrow, but this is what the primary concern is. Is there something that I should be or should not be doing CFT wise for this baby?
The 11-month-old?
13-month-old, and she's
13-month-old.
delayed in her milestones as well.
No, I don't see any contraindications of doing CFT at all. I mean, that's a challenging age for sure to be working, and if she's got other, I don't know if she's on the, autism spectrum at all, but you work with peds, Jagruti, so you have to be creative and, be on the floor and distract and, do all those kinds of.
Yeah, my only concern was like, I have not seen her, but mom said those movements that she does, like they look like stimming to her. That is what mom described to me over the phone. And they have been present since birth. So I was just kind of asking mom about if she has a clearance from neuroinfantile spasms wise or, seizures wise, just to make sure that they are not seizure-like movements for that age. So that's why I was like, do I need to hold off doing CFT tomorrow, or can I do certain areas before, so that I'm not directly on the brain? Like kind of anything that come to your mind.
I think at 13 months old, you're going to work where you can work with her. I don't think you're going to be able to, have a protocol set up in place. You're going to have to get to know her and see what else she's got going on. But certainly working with kids with autism, we see that, that stimming kind of behavior. It's okay. We're still working with them. I've worked with a lot of kids with autism, and a lot of times with them, sitting in my lap, sitting on the floor, walking around with them a little bit, mom's doing different things like that. So I think you're concerned about the stimming behavior, right?
Yeah, because I haven't seen her. So mom describes it to be like involuntary movements, and she kind of sometimes lets out a cry. So I was like, are they seizures or are they stimming? And mom said they're present since birth, and she's constantly in a fight or flight mode when she does that. Like it's her kind of regulation, like self-regulation, to come out of that fight or flight mode. So I thought it sounds like mostly stimming to me, but I was like, does she have any neuro eval or a neuro screen done to just, clear her off if we are not dealing with seizure-like behaviors here? And mom said there is no history of seizures in the family. So I was like, okay, then maybe we can just see what to do tomorrow, like eval-wise. She's coming for a full eval, so I'll be doing a part of PT eval, but then she's also wanting to come get CFT done, so I'll be touching a little bit on CFT. But she's driving 2 hours to come see me, so I'm like, okay, I'll do a little bit of CFT, but I just wanted to make sure that we are not having any contraindications, kind of.
We do work on people with seizures, so that it isn't necessarily a contraindication that you can't work on her if she's having seizures. So
okay.
But with that said, I will tell you that the people that I have worked on with seizures, when they have seizures, they often go back to zero brain cycle. So it's like very frustrating. But then I have had, I remember one case of a boy, it was maybe in middle school. He had these very slight seizures. He was told he'd never be able to drive. And he came to me for stomach issues, I think was his main complaint. And lo and behold, the seizure stopped, and, he grew up driving, to everything normal. So did the CFT do that? I don't know, but it's not a problem. So I think you're going to be okay.
Yeah, I just wanted to make sure that it's not like a contraindication that I'm dealing with, and without, like, do I need to get a clearance from the neuro first or anything? But I feel like if there is nothing else going on, I can just try and do.
Yeah, you can always follow your intuition, Jagruti. So if you feel like you're not comfortable, just get the clearance, but it's not listed, that's a problem. So
okay, cool. Yeah, and then I just wanted to share that I just saw like a 4-year-old who also had a tongue tie done when she was a baby, and she came to me because she was not getting a whole bunch of things and wasn't meeting her goals with her usual PT. one session of CFT. The first one, her single leg balance improved like from 3 seconds to almost 10 seconds, and mom was happy. Second session, she saw me. She was talking a whole time. And mom was like, her speech is much more clearer, and she's talking more, is what we've noticed. But she's also kind of breaking out of her shell of being scared. And that's the first time when she independently jumped in the pool with her guard around and did not get scared. So mom's like noticing these small things and bringing up to me, and I'm like, okay, that's great. So we've seen like a lot of differences just within 1 or 2 sessions of CFT. So I know it has been great doing that and having it as a tool. So just wanted to share some wins.
Well done. Yeah, we love to hear the wins. That's
Thank
great.
you. Thank you.
I have a couple questions here that someone had emailed me. So I'm just going to, I'll address these from Chelsea Rojas. If a baby or young child arrives at the session asleep, is it recommended to still work on them? What are the best practices for this? That's a dream to me. I love when a baby shows up asleep because it's a great chance to just, to at least come in and maybe get some brain cycle and, maybe start a couple little soft, movements and adjustments. So I have no problem if the baby's sleeping. So when babies are nursing and they fall asleep, it's a great time to work on them. So you certainly don't want to startle them. So you have to just be gentle. And but I would say, yes, Chelsea, you can go for that. Let's see. Can anyone speak to working on your own child? This is a common question we get in class, especially when they are in the 1 to 2-year-old range. What are some tips and tricks for this? I'm having a hard time as my child constantly pushes my hands away or moves away whenever I try. That's not only your child, that is most 1 to 2-year-olds that you work on. I have a 1-year-old coming tomorrow, and it's like, okay, I need to get a good night's sleep and get ready for that because they are going to bat you away. They're going to be strange. They're going to be moving around. So like Holly said, you've got to be prepared. It's the art of distraction, making friends, having toys and things like that. Now, these are for kids that are coming in as a client. If it's your own kid, you have the opportunity to be working on them consistently. So if you do 3 minutes at a time, that's fine. It doesn't have to be a whole 30-minute session, lay down on the table here, because they're just not going to do that. So when you're playing with them, or maybe they're watching a movie, or you just have a little bit of opportunity to get in and do a little bit of CFT, over the long term, you're going to get a lot of good work done. So, that's how I would approach that. You certainly don't want it to be something that the kid is going to become very adverse to. And I think over time, when they have the good feeling of CFT, then they want it and they'll start to seek it out. So I would say be patient and keep trying in little bits. And then are 30-minute sessions enough to get good outcomes for follow-up sessions, or do follow-ups always have to be an hour? Yeah, I mean, 30 minutes is fine. A lot of times it's just like, how do you want to set your practice up as a practitioner? Do you want to be setting up 30 minutes, or do you want to be setting up, on the hour? I find that the hour works. There's still a lot of conversation and education going on with these sessions. And a lot of times, mom's not only bringing one kid in, but, 2 or 3 other siblings, and I can kind of swap them out, and I'll split a session, sometimes an hour, sometimes an hour and a half. So each kid is maybe getting, 30 minutes total. So yes, I think you can certainly do 30 minutes if you want.
All right, Brittany's had her hand up for quite a while. It's been so patient. Brittany, if you want to go ahead.
Just so I always have a few questions because I keep a little tally. Have you worked on anyone with swallowed objects with success, Tourette's? And then have you noticed any more movement in the sacral area if someone's having their menstrual flow?
Okay, say the first question again.
Swallowed objects. Have you worked on anyone that has swallowed an object, and has it helped them like pass it through quicker?
I have not.
Okay.
No, what object got swallowed?
It was like a nickel, I think, or penny. I didn't actually work on them because I was like, well, I wasn't asked to, but I thought of it since I had one of my friends' nieces had swallowed something and they were gonna have to wait till like the following Monday to like go to the doctor or whatever if it didn't pass through. But anyway, it's like, huh.
I haven't had that one.
And then Tourette's, have you worked on anyone with Tourette's with success?
Tourette's, I worked on kids with tics.
Yeah.
So I don't know if it's categorized as, if it's officially Tourette's, but definitely have worked on kids with tics and have seen a lot of improvement with nervous system regulation, which then of course helps with the tics. And I think
Okay.
Kim, yeah, same for you, Kim.
Yeah, definitely. I've had some tics just
Okay.
completely resolve. I've had other tics
wow.
just lessen. I've had them go from something kind of like, I'll say like a violent type of tick, like very aggressive, to something a little bit more, it's still there, but it's just more mild. So yeah, definitely have seen some improvement with ticks.
Neat.
Yeah.
And then have you noticed like if the sacral area has more movement if someone has their menstrual cycle, like the flow?
I can't tell if somebody has, if they have their period or not.
Okay. I just like I've been working on someone ever since November when I took the training, and the last time it was like everything was like flowing so good and like the sacral was, so it just like felt like everything came together. But then she mentioned that she had her period, and she's like, do you think that made a difference? And I was like, I don't know, but so I thought I would ask if.
Yeah. I mean, it'd be something to start to notice and to just take note of, but I can't say
Yeah.
that I've noticed that.
Okay, thank you.
Oh, you bet. Anybody else?
We have a question over here from Renee. I have a 2-month-old that just starts crying as soon as he is laid on his back. He had a tongue and lip release done at 3 weeks old, and I have given him a couple of treatments before the release and have been giving treatments once a week since the release. Is this the midline that needs opened up, or what am I missing? I'm not sure that I understand the question about the midline that needs to open up, but yeah, as far as babies laying on their back, a lot of times they don't like to be on their back. So we have to work with those babies in other ways. 2 months old, you're going to have to, probably be holding and supporting. If they can hold their head up, and you can be working with them against, on your body. You can work with them in mom's lap, nursing. And once they get head control, you can have them seated and be working in that way as well. I don't think I understand the midline question. So Renee, type that in or
Yeah, it sounds like she's tying that into like the tongue and lip release. If it's, maybe she's feeling like she has to do more in that area, but it's,
well, that's common that babies don't like to lie on their back. A lot of them don't. So
yeah, as
you
they go.
you can also work on them on their tummy as well if they like to be on their tummy or side lying.
Yeah. Another question I had is, I can work on him, but it just seems like when he's laid on his back, he's in pain. Like I'm missing.
Oh, I see.
Something that needs to be unwound, and I'm not being able to find it.
We'll see that.
Yeah, I was just going to say that. Does he have like reflux or digestive things going on?
Not that I know of.
Because that could be part of it. And sometimes the silent reflux is, missed. And some of those babies are very uncomfortable with that. So I'm not sure about, diagnosing that and where you would have that diagnosed, but that could be part of what's going on.
I think a lot of times we see these babies that they say they don't like to lay on their back. And then after some CFT, I mean, even just in the trainings, all of a sudden, oh, look, baby's laying on his back. He's not crying. He's not fussing. Same thing. They hate tummy time. And then the next thing you know, we do some CFT and then they're doing much better in tummy time. So I do think that a lot of that can be related to tightness in their body. So I would say keep doing some CFT and see if you can get you know, but don't be doing it while they're on their back crying. That's not going to go well. So you've got to get creative and just, you know, in some other positions and, you know, do CFT that way. And then you can always kind of come back, or mom will just let you know that that has kind of resolved. So,
Thanks.
yeah, sure. Anybody else?
How's everybody doing? Oh, go ahead.
Have you guys seen flat feet resolve in children through working with CFT?
Flat feet.
Flat feet.
I personally have not had that condition, and like that I've been looking for that. So I can't really speak to that.
Okay.
I don't know, but I am curious about, you know, as we see a lot of the, you know, feet related, you know, to the tongue, as we know, we see that, you know, the deep front line of fascia, but just in general, as other things correct within the fascial web, it's possible. I haven't myself seen that either, or had somebody ask me about that, but it's certainly something to like notice. I don't know.
Okay. Have you guys seen low tone improve with sessions? Like, not necessarily resolve, but that kids are able to engage their muscles better? Like low tone kids are just so floppy.
Yeah. I think so, with a combination of like other things that they're also doing. So I don't know whether it's just CFT, because they're doing some other OT and reflex integration things. So I don't know how to like separate out what I'm doing with CFT with you know that as well. But I mean, like we always say, if fascial strain is part of the condition, then we're going to see improvement with it. Is that alone, CFT alone, correcting it? Probably not. It's probably, you know, reflex integration and some other OT and things that they're doing as well.
Okay, thank you.
Welcome.
On the feet thing, I will say I have had success with plantar fasciitis. So I don't know how much, you know, that's related, but I do think, like Holly said, there's so much more involved than just the flat foot. So it could be coming from the pelvis, it could be coming from anywhere in the body. So I would keep working with that and see if you got any improvement.
Okay.
Thank you. Anybody else?
Yes.
All right.
I have a question.
Debbie.
Sorry.
Go ahead.
I've treated 2 half-hour sessions on a 10-year-old boy who is on the autism spectrum. He's high functioning, according to the mom. Saw him last week, saw him today. I'll see him next week. I read Dr. Berry's article about having the children sit with their feet dangling and working specifically on the neck. So I went with that, and he's more comfortable lying down. So today that's what we did, and I went with that too. I could still access the neck. I'm feeling more head tension than I am neck tension, but I'm still drawn to that area and still feeling things there. As I progress with him, I mean, I'm comfortable following the body and what he wants to do, but in the back of my mind, I'm also thinking about Dr. Berry's specific protocol with this population. So any advice with that as I continue to treat him? The mom she'd heard about CFT. She's done some research. She's bringing him for half hour, and right now it's weekly. She's hoping to get improved expression with him, and improve issues with his constipation. But I've really limited my explanation with her and just said, you know, I need to follow his body and where the tension is. And she seems comfortable with that. But I'm a little torn as that practitioner with what Dr. Berry had suggested with this population and how concerned I should be, whether he's lying down or sitting up, and if I should stay on the neck and head for a while.
So, and Barry's on the call. Barry, you could certainly jump in, but I would just say that, you know, we never go in with a specific protocol. Okay, you're autistic. Here's my protocol for that. Here's my protocol for migraines. Because we're going, it's sometimes better when you don't even know what's going on. You just go in and you feel where the body's going to take you and, you know, help release and unwind from there. So we teach, yes, you could be seated, you could be standing, you could be lying down. So sometimes one works better than another. And you can kind of, if you don't feel like you're getting anywhere lying down, you can sit them up. And if you don't feel like seated is working for you, you said you felt more comfortable lying down, lying down. It's, you know, they're options for you. So it's not the protocol for autistic kids is to set them up and hold them at the occiput and hold them at the neck.
Okay.
You know, that's kind of I'm just going to say, I mean, I think that's kind of a quick way in to do a quick,
Okay.
like access of the whole body, feeling, you know, strain through the body at that point. But yeah, if you're not comfortable with it, go lying down with him.
Okay. Yeah. I started that way with both last week and this week, and the sessions went to other places, and that's totally fine. I just went with it. And then, you know, after today's session, I thought I'm going to have to ask them about this going forward, just so that I feel a little bit more confident in how I continue with him, so that I'm not thinking of it during the session. But during the session, while we're there, everything's been good. I was just wanting to make sure I wasn't overlooking something. So
A lot
thank
of
you.
times I may start with someone lying down, and then, you know, at some point, maybe towards the end of the session, I may sit them up. So, you know, play with it and see.
Okay. Alrighty. Thanks so much.
Let's see. It says, do we have a chat in there? Allie, the 3-month-old, just diagnosed with, oh boy, cerebral ventriculomegaly. Of course, I get this from Molly. Basically, enlarged ventricles in the brain where CSF can get clogged. No shunt is needed. Any suggestions or guidance for this diagnosis? Feel like it's a great opportunity to see benefits with CFT. I've been seeing her sporadically for a couple of weeks now before the diagnosis came along. I guess maybe specific hand placements or what I should be feeling for specifically. Okay, so the 3-month-old has large ventricles where the CSF can get clogged. No shunt is needed. Any suggestions or guidance? Okay. So again, we're not going to have any kind of specific protocol. You've already been working with this baby, and hopefully she's already maybe seeing some improvements. So I would keep working with the baby. I don't have any specific protocol for this type of a condition other than you're feeling for the tension and the tightness and you're helping the baby release. So, yeah, I don't know, Holly, have you ever come across this condition before?
No, I was thinking this is different. I was thinking I've worked with babies that have had vein of Galen, but that's a different condition.
Yeah.
Yeah, this is CSF in the ventricles getting clogged. No, again, like you said, we don't, you know, we're always just a co-pilot. We're always following, you know, this is a baby, so that infant-driven movement is going to be pretty easy to follow. It should be pretty easy to follow, and you're going to follow. Yeah.
Yeah.
I'm curious. This is something CFT should be really helpful for this baby.
Yeah, definitely.
Yeah.
Anybody else?
It's new to me too. I thought so too. Yeah. Okay, good. Yeah, well, keep us posted, Allie, about what happens with your, you know, this, hopefully you'll get to work with this baby for, you know, continue. Good. Okay, cool. yeah, let us know. And, you know, for those of you guys that are working with some of these very interesting cases, we would love to, you know, have a case study, have you, you know, send that to us so we could feature it, put it in our newsletters, or even have it be a discussion, you know, on a, you know, one of these Q&As, you know, to get on and talk about it. So yeah, keep us posted with that.
I think we have one from Brandy. If that's Brandy from our last class, is it? Okay. Oh, you always work through all 4 points to open the system, and then obviously wherever that leads, or do you ever work just one, I'm sorry, just ever work just one opening release and maybe have that lead you through other releases, but do not do the other opening releases. Not sure if I'm being too rigid, making sure I do all the releases for opening the system while making my way through the rest of the web, etc. Okay, so good question. I think what you're referring to is occiput, frontal release, cervical release, sacral release is kind of those just 4 primary touchstone techniques to get started. Somebody's puppa is is that you, Holly? Is that your
It's
pup?
not Desmond, no. He's
All right.
sleeping.
Okay. So you know, I think it's always a good idea to check in with those, but if you start at the occiput and you're drawn somewhere else and you get into, you know, a whole big thing with that's where you're going to go. And then if that gets quiet and then you want to go back and you want to check in on frontal, that's great. If you want to check in on sacrum, I say you're pretty much always going to check in on occiput and sacrum for sure. I think it depends how long your sessions are. And an hour session, I pretty much have enough time to at least be checking in those areas. So, anyway, that's, you know, you don't have to be rigid. We don't want you to be rigid. We teach you a protocol, or we teach you an order. We have to show you hand placements, but, you know, like we said, one hand is on the system, either the occiput or the sacrum. The other hand is out looking for that fascial strain. So, you know, you can just keep that in mind and see where the body's going to lead you. Sorry. Oh, no, you can't hear. Okay, sometimes I'm worried I stop too soon, and I'm always checking in all 4 locations, sacrum, occipital. Makes sense for sure. Thank you. Okay. Yeah, don't rush anything. Don't think that you're running out of time and you have to check in somewhere. Just keep going with the releases that you're getting and that you're doing the work. That's it. You did end up hearing it all. Okay, that's good. Thanks, Brandy. Anybody else?
It's a quiet night tonight.
It's quiet. I know. You should be so tired of hearing us talk too. How's everybody doing with brain cycle? Like, anybody have any questions? Are you struggling? Yeah? Yeah, maybe.
Some of it's gotten better than others. It just depends. I practice a lot of grounding and set aside time before I treat somebody to get myself centered, like I would do for my massage clients, but I'm finding I have to be prepared to do less. I have to be prepared to be the co-pilot. And so that's really been helping me, especially when I first make that contact. But sometimes I will notice some people within 5 seconds, they're really active and I'm not going to get a time on this person because they're already starting to release, or it's really mild, it's really faint. Okay, what's it doing? Let me at least, like you guys talked about, just feel if they have something, especially if they're like under the age of 4, you know. So I'll feel like, okay, there's something. And then I just make a note and see if I could get a time or rhythm. But there are multiple, I've treated the same person multiple times and I might not be able to get for sure what it is. So I'll note, okay, it's really active, not able to get a time, or it's really faint, or, oh, they went into a release. So I'm still making note of it for myself, but I'm not at that point of like, oh yes, this child or this person or this baby, it's 30 seconds for sure. And I'm okay with it. I just, you know, I haven't hit that consistent stride, but it'll come.
Yeah, it will. It's a lot of practice. It's a lot of practice. So, and it is, it's just noticing, are they expanding? Are they contracting? That's enough to get started, you know, and then you'll start to notice the nuances of the pauses or the bounciness or the faintness, the amplitude, you know, we're looking and listening for all those things, as well as timing. If anybody needs a review on timing, we can briefly go through that. But so I say, keep trying, keep practicing, don't give up. It's to me, it's a very integral part of CFT. It's a really good tool to help us know what we're dealing with when someone comes, how much tightness there is in that system, and then how the session went. Did you open it up? Is there improvement? And you'll see the correlation between the brain cycle improving and their symptoms and them, you know, feeling better. So, yeah, just keep practicing.
And let's go over brain cycle counting it, because we do have someone said yes. So we're landing on, we're landing with your hands in a comfortable position. And you're waiting to ask, are my hands being drawn closer together? Are they being pushed apart? So we establish that. And once we know what we're doing, whether we're going into contraction or we're in expansion, we're just waiting there and we're feeling that, part of that phase of the cycle. And then when you start to feel it transitioning into the next phase, expansion or contraction, it doesn't matter. We're going to start counting from there. So we're going to count, let's say we get to 25. We can, if we wanted to, count the other phase. It should be around 25, but normally we just double that because we expect the expansion to be the same as a contraction. And then that's going to be a brain cycle of 50. So that's basically how we're doing brain cycle. And sometimes it takes a little bit of time to just land there and wait. Your hands are going to start to move in one direction or the other. You're going to feel it in your arms. You're going to feel it in your whole body. Close your eyes. I feel like the lighter the touch, well, for me, the lighter the touch, the easier it is to feel. And the less I'm trying to figure it out, it's just your hands, it just, it comes right to you after, of course, lots of practice. So just keep doing that. And say, when you said, Debbie, just you're feeling the expansion, you're feeling the contraction. It might feel far away. Things might feel tight. You do some CFT and then you land and you're like, oh, wow, I really feel the expansion now. So, that's what we're looking for. Don't get too hung up on numbers.
Right. I think I'm at that point where I'm starting to feel that more and more. And like I said, I've had some clients where it's been great. It's been easier to read than others. And then I'll test it again. It's like, okay, they're a definite seven seconds. Like it's just 7 seconds and it's repeating. So if I get it, I get it. If I don't, it's okay. I make a note and move on. And then there's been times where I'll try to check it at the end. And sometimes it's definitely an improvement across the board with nearly everyone. But today I had a client and he was still going to go into a rotation pattern with his head, even though I'm sitting there trying to time the brain cycle. And that's okay. I was still guiding him through that. So there's often cases like that where I'm not able to get that timing. Yeah. But I'll make a note of what rhythm I felt or the strength of it or something. But yeah, I do see several people where within a few seconds of holding their head, it's like, oh, we're off and running. Here we go. Okay. So
I had a lady yesterday who I've seen a few times now, and she's been making a lot of improvement. Came in a 0 brain cycle. I mean, her cycle's very nice now. It's somewhere up in the high 100s, 200s, improving with her symptoms. And she came in, and I said, oh, how are you doing? And it was kind of like, it wasn't like her typical great self, but she was kind of quiet. She gets on the table. I have my hands on her head, and I'm thinking to myself, what happened? I mean, she's completely shut down, and I'm not really saying anything. And then I just said, so what's going on? And she says, my sister was diagnosed with cancer. Oh, and I felt really bad this weekend, like off of the attic steps, and she's describing this fall to me. And I kind of like, I'm like to myself, I'm like, oh my God, this is so amazing. Like, you know, I felt this, I felt it shut down, and here she's telling me exactly why. So those things are like very confirming as a therapist when you realize that just the correlation between all of it. So, anyway, you know, went through with her session, opened her back up. She's well on her way, but it matters. So keep practicing. Yeah.
Okay, we have a question from Jamie. The adult I was working with started at a 0, and at the end of the first session, she was at 4. She was able to hold that 4 until the next day. I did another session with her, and after that, it went up until a 10. Is that okay that it's such small increases, or am I missing something, or that just getting caught up in numbers? I don't know. That seems like usually when somebody's at a 0, unless I haven't had that situation. I don't know if you have, Kim, where they don't increase, I don't know. Have you had that?
And very few or they've increased that small, but it has been like a very severe situation, like severe brain.
What's going on with them, Jamie? Do they have, why are they getting CFT? For what reason? Yeah, I haven't seen something like that. Autoimmune? Okay. Do you feel comfortable getting brain cycle? I mean, are you feeling comfortable getting brain cycle? Because it could just be, if you're not comfortable with brain cycle, yes, I do feel like I can get it after I work with most people. Okay. Well, a lot of times people, when they come into you, remember this, they probably don't have much of a cycle. If they have, if they have had CFT and they have, a lot of stuff going on. So yeah, if things feel really tight, like Debbie was saying, then all of a sudden you can feel things open up. So that's what you should be feeling and noticing. I'm not really sure about somebody going from a 0 to a 4. I've never had that happen in that, such a small increment.
Yeah, I would agree with that.
After work. Okay.
So it could be a misread on the brain cycle. I mean, it could be. We're all practicing. We're all still, kind of figuring that out. Or there could be something really serious going on with this person.
Yeah.
Yeah.
Anybody else? Brain cycle.
How about even like if you want to talk about how you're implementing this and blending it with your business, how you're marketing to people, are you getting referrals? How are you explaining CFT? Anything's fair game here.
Here we go. How many seconds one way is a good cycle? So this is from Renee. Okay, so we say at a bare minimum, we want somebody to be 100. So if somebody comes in and they're a 10 or 15 or 20 or 30, whatever, we want to work our way up to 100. So that's going to be 50 seconds out, 50 seconds in. So expansion 50 seconds, contraction 50 seconds. We really want to see them get up into the mid 2s. We know that when they get up into the mid 2s, that things are going pretty well for them. So 100 is just the minimum that we want them to be. So yeah. And often we see the biggest jump is going to be in the first session. First and second sessions. I have a question about plagiocephaly. Is there a place you put your hand specifically to their hand shape?
Head shape.
Head shape, I'm guessing. Yeah. Prominence of no, we're landing on their cranium just like we do any other baby, and we are working with the fascial strain there. No, we're not. We don't have hand positions for different head shapes. Head, yes, got it.
So if when someone has like a mouth guard or glasses, something that they need that's shutting down their brain cycle. Is their brain cycle gonna pick back up in the morning, or is it like once it's shut down, it's completely shut down? Are you kind of like fighting against, if it's for sleep apnea, like a device that pulls the jaw forward?
Well, I found that when they take the device out or they take the glasses off, it will go, the cycle will go back. So, and we do that, we test it. We showed you that in class where we will be feeling somebody's brain cycle, they're expanding, they put the glasses on and it may shut down. Take them off and then, it starts moving again. So we could test anything like that. If you want to test, I test a lot of the, retainers and bite guards and all the kinds of things people wear in their mouths to see if it's either shutting down or slowing down their cycle. And then I don't tell people what to do, but they have a decision to make, about what's shutting down their cycle, if it's more important for them to have an open cycle or to continue wearing their retainer, whatever they want to do. But it's like information for them. But it should, once that appliance or whatever it is removed, it should go back.
Okay, thank you.
Yeah, it's very interesting when you start to sleuth around about why things are shutting down, and it could be some kind of an outside influence like that.
Anybody else?
There's one in the chat here. Let's see.
What's that?
How to bring up, this is from Brittany, if additional sessions are beneficial, so client not pressured or turned off. Okay. So a lot of times what I find is that people are asking me, okay, so what should I do? When can I book again? Like they're asking me that they want to come back. But if it's a situation where you're feeling like maybe you're selling them something, or like, no, we're not ever. We're just explaining to them, first of all, it's rarely one and done. Sometimes, sometimes it really does make such a benefit in one session. But I always tell people, let me at least have 4 sessions before we determine if this is working or not. In my mind, I know they're probably going to feel something in 2 or 3, but I give myself that 4th cushion so that they at least have an expectation that they are coming back for a few sessions. And then we're going to track progress and we're going to see. And I just say, like I said, we're just looking for some kind of progress. And if they start to feel better in some ways, then we know we're on the right track and the fascia could be a part of this, a piece of this issue for them. So I wouldn't bring up additional sessions if I don't even feel it would be beneficial. So, but if you feel it's going to be beneficial, you're going to explain, why that is. And I think that most people are coming to you because they want help. And listen, if you can help somebody with their migraines of 20 years in 5 sessions and probably under $1,000, they're going to be lined up out your door. The biggest problem with this work is that it's uncertain. And so it's unknown if what you're doing is going to help them. But I think when you explain it to them, most people say, that makes so much sense. And you give them a sense of hope. Somebody comes in with an issue, they're at a 0 brain cycle, and you explain, excuse me, what CFT does, makes sense to them, and they have hope because they've been everywhere else and they're not getting better. Does that answer you, Brittany? You're welcome. Okay, good.
Well, we're coming up on the hour. So if anybody has any final questions or comments, now's the time.
I have a quick one. Just so that I'm clear on that surgical piece, I should avoid the area, obviously, no matter what surgery it is. But is there like a days to weeks that we wait post-op? I know it was only a few days maybe for a tie release. And I know there's other areas of the body I could treat, but can you address how long we might have to wait for different types of procedures? Or am I just having a local contraindication?
I don't know, are you talking about a particular kind of surgery?
Decision, right?
What?
Were you
Yeah,
asking
we,
about the circumcision?
I asked earlier about the circumcision, but
Yeah, I mean, I would just, everybody's different, you know, but I think that, you know, you can safely work on other, you know, more globally.
Yeah.
Definitely. And I think, yeah, I think you're going to get, the person's going to get relief from having CFT, you know, because their body is going to be compensating in all the other areas, you know, so I would definitely try to work as long as they're, you know, comfortable with it and it's okay. Their, you know, their provider, you know, their physician or whatever approve, you know, whatever clears them for whatever the condition is.
okay. All right. That's what I understood. So I just needed that little
Yeah.
clarification. Thanks so much.
Yeah.
All right. Well, thank you, everybody. I hope this helps. You know, we'll continue to do this as long as you find it beneficial. Gather up your questions, you know, just keep a little card and write your questions that you want to come to us with next time. Thank you, everybody. You're very welcome.
Yeah.
So
Yeah, you can also send them to us too, and we can gather them up too. If you know, you could write them down, but you can send them to us. Yeah.
if you can't make the call and you still want to have your question answered, and then it'll just be on the recording you can listen to. So
Yeah. Awesome.
because I'm sure that your question is one that everybody else has as well. You know, and it's great to hear that all of you are out there doing this great work and, you know, working on these babies and kids and getting results. So that's what we're all in it for. It's to get CFT out there to as many people as we can, and you're really making a difference. So we thank you. Thank you for being here tonight. And we're here if you need us in any way.
Good night, everybody.